Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and if you follow our YouTube videos, you know that I use the Ellman Cynosure 4.0 megahertz radio wave system a lot in my cosmetic facial surgery practice. This system is applicable to just about every specialty where there's anybody that does any surgery on humans or in veterinary medicine as well. Radio wave surgery is different from electrosurgery. The tip never gets hot, never gets red hot. It just does much less lateral thermal damage to the tissue. And so the basic advantages of radio wave surgery are that you have incision with hemostasis, you have less lateral tissue damage, so it's a bloodless incision that promotes better healing. So because you have very little bleeding, you have less bruising, less pain, faster recovery. Now, I get asked a lot, what settings do we use when we use the radio wave surgery? So what we're going to do in this video is show you some of the actual electrodes and talk about the settings. I'm Dr. Joe Niamtu for Ellman Cynosure, LoveThatFace.com. Okay, so what we're going to do is talk about the Ellman, and this is one of the 4.0 megahertz dual radio frequency machines. They have different machines and they upgrade them frequently, so you may or may not have this machine, but the theory and principle is the same with all of these machines. So basically you have two things. You have your active handpiece, which usually has 3 buttons unless you have a foot pedal. It's cut, blended, and coag, or hemo. And you have a neutral antenna, which is a grounding plate, but this is not like electrosurgery where you can get shocked or burn the patient. It doesn't even have to touch the skin. We keep ours under the cushion of our operating table. And what this does is it plugs into a household current, it generates radio waves, they come out of the active electrode, out of the tip, and they cause the fluid within the cell, the intracellular fluid, to boil, which is called intracellular volatilization, and that's what splits the tissue. And so this never gets hot, unlike electrosurgery where that can get red hot and melt. So in electrosurgery, the tip or the electrode provides the resistance. In radio wave surgery, it is the tissue that provides the resistance, and that's why it is more gentle and very hemostatic. So in a lot of respects, clinically, they work the same. That's both an electrical source, but if you look at this histologically, you have a lot less lateral thermal damage with radio wave. So these electrodes go into your handpiece. Now, you're not going to be able to see this in my hand, so I'll put an inlay on the video. But this is probably the most common electrode we use, and this is called the very tip. And it's a very thin, fine wire that you can pull out to make longer or shorter to adjust the depth of your incision, and it's reusable. You can autoclave it or gas it, or if the end gets bent, you can clip it off and keep pulling wire out of it. This is, I believe, the finest wire that they make for incision. So when I'm making skin incisions, eyelids, facelift, anything, earlobe repair, anything on the outside, I will use this. And this is also fine for ENT stuff or oral and maxillofacial wisdom teeth incisions or any intraoral type incision. The thing about this system is it's used in so many specialties: gynecology, ENT, hair transplantation, oral and maxillofacial, veterinary, plastics, facial plastics, dermatology, on and on and on. So this is the very tip electrode. Now, when I want my most controlled incision, my best scar, like if I'm doing, say, eyelids, not using a laser but using the radio wave, I'll use pure cutting. Now, the pure cutting, that's usually about a setting of about 20. So, I tell people it's anywhere from 12 to 20, and what you want to do with these is you want your power to be not too high, because the higher your power, the more lateral thermal damage you're going to do. So you want to be able to glide through the tissue easily without sparking, all right? And if your power is too low, it's going to not glide through the tissue. It's going to kind of catch. So probably we're using 20 for the most part, but you have to play around with this, and it's also different on some patients, and I'm not sure what the variables are, but on bigger patients that may have you know, more resistance to electricity and those kind of factors, you may have to tweak this. So on some patients it may be 30, other patients it may be 15, but we pretty much put it on 20 and leave it on 20. The second button is for blended, that's the cut coag. I really don't use that much at all. The third button I do use, and that's hemo. So that's at about 35, and that is a setting that I will use if I really need hemostasis. So inside the mouth or on mucosa, other parts of the body, where you're not worried about a scar, I will use the pure. Right, so as we continue, the next most common electrode I'd say is their Ellman Cynosure's Empire electrode. And this is really the same thing as a lot of people use the Colorado microneedles. This is the same thing. It's a tungsten electrode, and it has a very fine tip, but it's like a cone, and it gets wider. So you can use this for eyelids and skin incisions. However, if you do that, you have to use just the tip, because if you go deeper, the electrode is wider. And this is a very rigid electrode, where the very tip is a fine wire electrode. So again, this is a kind of a general purpose electrode. You can use it in the mouth. You can use it, you know, people use it for labiaplasty. You can use it for skin lesions. And you just have to, if you're using this electrode for a critical incision that's going to be visible somewhere on the face of the body, you just want to use the tip of it. And if you're intraoral or in the nose or something like that, you know, obviously you can use more of it because you don't have to worry about a scar. Now, this used to be called the 133 electrode, and it's now fondly called the Niamtu electrode. Thank you, Ellman Cynosure. It's an honor. And this is what I use for mole removal and lesion removal. And it has a little thicker pin, you know, like the size of a small pencil lead. And again, I'll show you these on the screen here. So this is just to melt down lesions, and it has a flat tip and it's rigid. Now, all of these things, or most of these electrodes, can be bent, and that's great because you can bend them and shape them any way you want to, as the song says. And so you don't have to bend over, you can just change the electrode. So that's very ergonomic. Finally, in terms of electrodes, we have our ball electrodes, and there's different sizes. There's small balls and large balls, and we use these. You can use these to burn off lesions like DPNs or moles instead of the pin type electrode. I use this a lot when I'm doing ear surgery to reduce prominent areas like a pointed lobe or something like that. And anytime you're sculpting or melting, I use this for rhinophyma as well, although Ellman has rhinophyma electrodes. They have snoring electrodes. They have pallioplasty electrodes. They have hair transplant electrodes, spider vein electrodes. They have vaginal electrodes. They have myringotomy electrodes. They have matrixectomy electrodes. They have just electrodes for about everything. And you know, we don't really use that many specialized ones. This is the garden variety stuff that I'm telling you about. Now, if you do any type of surgery, like for cosmetic surgery, especially blepharoplasty or facelift, you absolutely 100% have to have a bipolar system. And with the Ellman, there are a number, again, they have a ton of different electrodes that are bipolar. And I like these silver tipped. It's a special silver alloy, and they don't cake as much as do the just the plain steel electrodes. So we use the big one for facelift surgery, neck procedures, or if you had to do something on the uvula or pharynx or palate, you could use that. And then there's a smaller one, which I use a lot, and I have a lot of videos using this for blepharoplasty or very controlled, fine hemostasis. So you have to have the bipolar. Now, you know, depending on which Ellman unit you have, you could also do Pellevé, which is non-invasive skin tightening. But in terms of surgery, I use this all day, every day, and I hope you benefited from this, because all the time people call and say, what do we use, what setting? So to go over it again, when we're incising on pure cutting or pure coag, I'm usually using the fine wire electrode, and probably about 20 watts. When we're using the pure hemostasis, okay, or the pure coag, that's usually at about 30. And when we're using bipolar, that's usually at about 35. And there's a lot of variability here, and it's like anything else, different people have different settings that they like. If you've enjoyed this video, take a look at cosmeticsurgeryeducation.com and look at our for-purchase video series in which we do just about all types of cosmetic surgery using the Ellman, and as well as scalpels, lasers, and everything else. Hope you enjoyed this video. I'm Dr. Joe Niamtu, lovethatface.com. Hi, I'm Dr. Joe Niamtu, cosmeticsurgeryeducation.com. Hopefully you follow our YouTube channel and you know that we have hundreds of free videos on cosmetic facial surgery, but today I want to tell you about our for-purchase video series at cosmeticsurgeryeducation.com. We have over 300 videos on virtually all facial cosmetic procedures: brow and forehead lift, blepharoplasty, conventional facelift, minimally invasive facelift, facial implants, chemical peel, laser resurfacing, fillers, Botox, lip surgery, management of fat in the head and neck, and you can see the list up here that is comprehensive. These are very reasonably priced. They're high definition, narrated. You can stream them 24/7, or you can download them and watch them at your convenience. Check it out, cosmeticsurgeryeducation.com. I'm Dr. Joe Niamtu.